Dr. Rebecca Walker joins us now, a research consultant with the African Centre for Migration and Society, which is based at Wits University. And Rebecca has written recently about this persistent myth in South Africa, fueled by groups like Operation Dudula, that the poor health care that many South Africans get at public health facilities in South Africa is because the migrants are hogging the care, hogging the attention, hogging the time of the medical staff. And Rebecca, good afternoon. That, no matter how persistent that belief remains, it is simply not true, and demonstrably so.
Yes, that's right. Good afternoon to you, John, and also to your listeners. The reason we wrote the piece is because of the very worrying momentum in terms of, blaming migrants for the challenges faced by the healthcare system in South Africa. And despite, the availability of credible evidence that, this isn't the case, this myth has, really taken on its own reality. I think particularly fueled by social media. And it's really become sort of the go-to argument that, when challenges are being faced, when people cannot access the healthcare that they need to, that it's the fault of foreign nationals, that there are those issues. And we know from data, we know from reports, we know from the government's own data that the South Africa healthcare crisis is driven by chronic underfunding, the collapse of the infrastructure and staff shortages, and not by the presence of foreign nationals in the country.
Foreign nationals, whether they are documented or not, probably do use our public health system, yes?
Yeah, absolutely. And under the Constitution, they have a right to use healthcare. They have a right to access healthcare. Our Constitution, Section 27, states that everyone has that right to access healthcare services, including reproductive healthcare and emergency care, whether you're documented or not documented, and regardless of where you are from. But knowing that, only 4% of the overall population in South Africa is made up of non-South Africans, there is no way, that they can be responsible for the challenges being faced within the healthcare system. And we also know that the problems in the healthcare system, predate any changes in migration patterns or, changes in migration numbers in South Africa. This is a long, sort of decades-old issue of challenges that have not been dealt with. And, we have the data, we have the reports that support that. We don't have the data that suggests that it is, the fault of foreign nationals accessing healthcare.
There is, in fact, some evidence that foreign nationals, particularly undocumented, try to avoid public facilities because they are concerned that arriving there without documentation might get them into trouble.
Absolutely. I mean, I think it's important to, say that we know that anybody who is accessing public healthcare system, 80% of the population use public healthcare. The majority do face challenges. I mean, there's very few people who don't. But we also know that those who face the most challenges tend to be those who are non-South Africans. Many don't even get past security guards at the gate. They face challenges in opening files. They get charged arbitrary amounts. So we do have evidence from research that has been done with migrants across South Africa that many will make alternative plans, and they will turn to any other form of accessing healthcare rather than going through the public health system, for the very reason that they know that the challenges of actually accessing care are so high.
I sometimes wonder, Rebecca, about the value of me having this conversation with somebody like you, two people who share the same view on this, and we're talking about why we believe that migrants, legal or otherwise, are not responsible for the problem. And I doubt that too many people who have that belief, who would turn out in an Operation Dudula operation outside a public health facility, are listening. And if they are listening, they are extremely unlikely to be dissuaded or have their minds changed by the kind of conversation that I have with people like you. And so for me, this really important question more and more becomes, how do we change people's minds when a view is as demonstrably untrue as is the view of Operation Dudula on this issue? How do you engage with people who have that view to at least create a 50% probability that they might think anew about the issue?
I mean, that is an incredibly difficult question to answer, and one, that I often ask myself as well. But I think, the importance is that we have the data and we have evidence, that challenges these myths, and we have to keep putting that data out there. We have to keep challenging the myths that are being shared, in the hope that, that at some point people do start listening. Obviously, the biggest challenge is the power that organizations like Operation Dudula have because of social media and because of the rate at which they can spread misinformation. And this is not just Operation Dudula, it's a number of different political parties in South Africa. We've seen, from videos that are being shared, we know that there's this general understanding or belief that that there's far more foreign nationals in South Africa than there actually are. We know from an HSRC social attitude survey that most South Africans think there are over 25 million foreign nationals in South Africa. So, we know that this misinformation actually goes very far and is so shared so much that it becomes its own truth. But at the same time, we also know that, we have to keep sharing that data. We have to keep challenging it. And, there's certain places that actual evidence needs to be coming from. So, yes, you and I can have a conversation like this, but we need government to stand up and say that these are what our statistics show, and to actually, come out very clearly to say this is not what is causing the problems in the healthcare system. But of course, to do that then means you can't scapegoat migrants anymore, and you have to look at who is responsible, and that leads back to government. So it's really about, we have to keep pushing for the right voices to be coming through, and we really, really need people in government who know very well what the data tells us to really stand up and to really challenge that rhetoric.
Yeah, people's minds are not changed by data, though. This is the thing, Rebecca. This is what as misinformation gets spread, as it is being spread and multiplied by the echo chamber effect of algorithms, more and more the prospect of a careful analysis of data and going, okay, that's what the data suggests, therefore I must rethink my position on X, Y, or Z. That seems increasingly remote a possibility.
Absolutely. But I think, if we look at, for example, the role of Operation Dudula, we have an organization that has not only been legitimized by the failure to really stand up and condemn what is happening, but it also was allowed to register as a political movement. And all of these little steps are what really puts power to that rhetoric and what really allows it to become stronger and stronger and to cover, the relevance of the data.
Thank you very much. Dr. Rebecca Walker is a research consultant with the African Centre for Migration and Society.